safety is the key direction they want to achieve. To achieve this target, I think staff or healthcare workers should not be separated when we initiate any initiative with regard to patient safety and safety culture, for example. So staff should be within that framework. Yeah, it should work hand in hand. Without healthy staff, I'm sure the patient safety initiative could not be implemented successfully. I'm sure in any healthcare industry, we have OSH or something like that with regard to look into the welfare of staff, their safety, their health status, so that they can deliver their work appropriately to the benefit of our patients, our shared patients.
Definitely something that you cultivate over many years, and not only to reach a certain level of safety culture, but also to nurture all your new staff. As you know, there's a lot of turnover of staff in the hospitals, so it's something that needs to be passed on and that everyone understands. I think it's very important to have a single safety culture, something that is simple, everyone understands the principles, and it trickles down from top. That means a lot of support from management, and it trickles down to every single staff, whether they are clinical or non-clinical.
Yeah, I may add, from a management perspective, the most important thing is healthy environment, adequate manpower.
Management has been very proactive in the sense that when they started to see different people have different coping mechanisms. For example, some respond very poorly to stress, some were able to cope. So, and those who respond poorly perhaps need a lot more support.
This IJN has also been designated as COVID, provided they have heart disease.
Okay. So
because the sign and symptom of chest pain and all those things is more or less similar to COVID.
I see.
So even when the first engagement with Ministry of Health, they asked us IJN to be part of the team if there is heart disease that requires some kind of intervention. I think the needs of treating that heart condition is more important than the risk of COVID infection itself.
In conjunction with World Patient Safety Day, we had a lot of activities. It's not just, so now we do it in the new norm, so it's more online education, and then online games and prizes. And we also had our first Patient Safety Award awarded to the staff who contributed most to patient safety. Also, I think what was nice that the management did was that because there were so many teams involved, let's say the infection control, there was the patient support group, there was the swab team, and all sorts of new teams that were developed urgently for this COVID-19. So what they did was they gathered pictures, and then they sent out emails to every staff per group. Let's say the patient support group, they put up pictures of all their initiatives, and then the infection control team as well. So there's a lot of positive message being put out to every staff, so everyone feels a bit more positive rather than during this COVID-19 everyone is kind of depressed and stressed. When JCI put up this communicable disease chapter, and this was, I think, in the 6th edition, I don't think it was in the 5th edition. It was as though they predicted something like this would happen, right? And I'm quite amazed that it just came out very in a timely manner. And of course, as I said, we had plans, we had drills, but we never expected to respond on this magnitude. So I think more importantly, even though you have policies and procedures, it's actually the adaptability of the organization. That means this is a new disease. There are new requirements, there's new ways of handling it, and the organization has to adapt very quickly. And what we did was, this time, whatever policy we had to there were multiple new workflows that had to be done. So we have a very sort of like a manual that hopefully we can also use in the future as a reference for this sort of pandemics.
Be prepared and work as a team, and keep on looking what are potential risks to healthcare. Secondly, importance of continuous communication and engagement to all staff and our client patients.
What the organization did was very good in the sense that it looked at our processes. Even those that may or may not be directly COVID related, but more of patient process related, like a patient journey related. So we implemented all the new norms and all the new processes. And by the time the MCO was lifted, we were already like quite a well-oiled machine. So we implemented slowly over that short period of MCO, and we improvised quickly. And so by the time we sort of reopened to the public, we felt that, okay, we were quite comfortable with our processes. And I think this was a very good lesson learned and a very good